who has gone through the process of surviving the experience of being diagnosed initially with prostate cancer. And what he's going to do is to tell us about his journey to wellness and the steps that was involved in all of that. So thank you, Danny.
Good afternoon, everybody.
Good afternoon.
Okay, so my name's Daniel McKenzie. I'm a multidisciplinary exercise specialist. I work in the Watford area. Okay, so prostate cancer. All of you would have heard about prostate cancer in recent years, and it is on the rise. So, and it's been in the news again just recently. Okay, sorry to see there's not many men here. Okay, however, ladies, if you have any significant men in your lives, please ask them to get themselves checked out. Okay, so my story. Okay, so when I was 40 years old, I heard something on the BBC, and that men approaching 50 should go and get their prostate checked, but black men and Asian men should be checked from when they're 40 onwards. So the following day, I went to the doctors. She didn't want to check me, but I insisted. And the check was, unfortunately, the physical check. So it's a finger in the bottom, so they can feel the prostate to see if there's any lesions on it. Back then, okay, it took a couple of seconds, in and out, gone. Okay, so every 2 years after that, I went and got checked. Insisted that I was checked. Okay, and it was almost like a battle to get the doctor to do it. Okay. So fast forward, it's 2020, COVID year. Okay, couldn't see a doctor. Okay, doctors didn't want to actually see patients, okay, through fear of COVID. So I left it. Okay, 2021, right, things were getting better on the COVID front, so I had a check done. Okay, so same old thing, finger in, felt the prostate. The doctor said, Miss McKenzie, you're fine. Something told me to get the blood test. I insisted that I got the blood test, so she didn't want to. She gave me the ticket, went to the hospital, had the blood test. And within 2 weeks, I got the result. I got a phone call from the doctor saying that we found something. Okay. Sorry, getting sort of choked up a bit here. Yeah, so they found something. Okay, so you know what? I thought to myself, don't worry about it. Okay, you get yourself checked every couple of years. Perhaps it was nothing. Okay, so I went to the hospital for an MRI scan, and yes, they found that I had something. There was something there. There was a shadow. Okay, so 2 weeks later, went and had a biopsy. Not a very pleasant experience, but it was necessary. And yes, there was. I had prostate cancer. Okay. It was really weird because in 2001 I became a cancer rehab specialist. So I learned a lot about cancer and the survival rate. So I didn't worry. So March 2022, I went to see a specialist. He then just said, right, okay, these are your options. Then me up my options, which was like surgery, radiotherapy. Those are the two options, yep, okay. Or, sorry, brachytherapy, which is like a radiation thing, and androgen therapy, which is like hormones. And I just said, I have surgery, I just want it taken out. Okay, so I got it taken out, and I've been free. I've been free from cancer since 2022. Sounds good to you, yeah. Okay. Now, I think I've done an online forum for WACA, okay? And the men that came on, they were frightened about going to the doctors and having the finger test, okay? And things have moved on now. So, it's a simple blood test now. They check the PSA levels in your blood, and that's it, okay? If it's high, then you might have an MRI scan, and then a biopsy. But these days, they're trying to get rid of the blood test and send men straight in for MRI scans. So there's nothing invasive at all, yeah? But it is very important. I'm telling you, it's very important that you get yourself checked out. Or, as again, look, there's so many women here, very few men. Get yourself checked out. When you look at the death rates, the highest death rates is from about 75. So men get to 75, find that they've got prostate cancer, and nothing really can be done. They don't like operating on older men for some reason, okay? And again, if you're African, West Indian, African, West Indian and Asian, you're twice as likely to get this. 1 in 4 men will get, from those groups, will get prostate cancer, okay? Opposed to 1 in 8 for European gentlemen. But again, we all need to get ourselves checked out. Okay. Right. Okay. So just again, look, I've more or less finished. Okay. As I say, important, simple blood test. Get yourself checked out. Again, look, I've been through it. Okay. Yes, it wasn't pleasant. But I'm here, yeah? I've lived to tell the tale. Okay? Right, lovely. Right, thank you. Thank you. Quick question and answers, yeah.
Quick question.
Yeah.
When you had, thinking like a man for a moment,
Yeah.
when you had it removed, were you under sedation or were you fully conscious?
No, under sedation.
Okay.
It was done, they made 6, you're on a bed, they tip you upside down, they blow your organs up here, go in with 6 incisions and then pull it out the side. And it's done robotically. Okay, so it's, okay. So
Thank you.
I agree with what he's saying. My cousin was more like my brother because we lived together.
Oh, sorry, yeah.
3 months.
Just give us a second.
Oh, it's round that tape, it's round the leg.
My cousin was 3 months younger than me, more like my brother because we lived together. And one day he came to me, he said, brother, he says, I've got prostate cancer. So I said, okay. I thought I'd get checked myself. So I got checked myself, I had prostate cancer. We both had radiotherapy and brachytherapy. I'm fine. My PSA is 0.002. Unfortunately, my cousin left it too late and he passed away. But he knew he had it, but he didn't do anything. So this is what you're saying, it's very, very important to get checked. I mean, I was lucky, no finger or anything, I had biopsy, the same as him. And but it is very, very important to get checked very early. I mean, there are many symptoms that you can look at, you know, that can tell you probably got cancer, prostate cancer. And they've got to look at those things.
Yeah. Okay, yeah. Just to go through the symptoms, okay, which made me think that I'd possibly got prostate cancer. It was like going to the toilet, feeling like you wanted to go to the toilet, full bladder, go to the toilet and you stand there for 10 minutes because you can't pee. The prostate's blocking the tube where the urine comes through. Okay, and then when you do go, you then stop, walk away. Oh, I still want to go, and you go back and you're just there, standing in front of the toilet, trying to pee. I mean, that's like one of the It's the biggest sort of symptom, okay? And if that happens, it could be that your prostate's swollen, okay? Or it could be that you've got cancer, okay? I mean, the PSA test it can give false positives, okay? And this is where you have the PSA test. If it's high, then they send you for an MRI. And again, possibly a biopsy, okay?
I'm really very quick, but I want to say a huge thank you. I'm a cancer survivor myself. It's not easy telling people about your experience. We bless you for doing that.
Right, thank
from
you.
me. And the second thing is we've got lots of resources on our stall about prostate cancer, including some specifically aimed at men who are black. So if anyone wants more information, obviously ask Danny, but also there's just paper copies if you want to take them away. Thank you very much.
All right, thanks.
And that's one vision.
Yes, thank you. I think it's a shame we didn't come with any statistics to show that the prevalence of prostate cancer in the African Caribbean community is much higher than in the wider community. Not quite sure what the reasons for that are, but I'm sure there is evidence and science out there too.
I don't think they know either.
Oh, they don't know, right, okay. It seems that we are the brunt of a lot of diseases for which there are no known causes, which is very frustrating. In terms of the symptoms, as you rightly say, the feeling of fullness and wanting to go to the bathroom is often one of the triggers, and it can happen at any time. Often men will want to go to the bathroom and they will dribble rather than have a full stream. And they won't empty their bladder fully because it's only been relieved. And these are some of the symptoms that if you are experiencing, and you don't have to be 65 and over to have these sort of symptoms. And these are the triggers. Now, as you quite rightly say, there are often false positives. A false positive is something that the PSA, which is a blood result, that will give an indicator that you might have a malignant tumour, because that's essentially what it is. But there's also benign tumours, and not all men who have enlarged prostates will have a malignant tumour, in which case the likelihood of their survival is much higher than someone who has a malignant tumour. So it's not all doom and gloom. The test that you talk about is now considered an invasive test that they can get away around. Certainly within the black community, having anything examined in that region is a big taboo, which is again why a lot of our men are hesitant to go to the doctor with the symptoms. Excuse me. Invariably, it's the better half, i.e. us ladies, who will know of our partners. There's a gentleman smiling over there, so that rings a bell, who will gently encourage our partners to go and do something. And what I would say is, if your partner won't go on their own, take them. Make the appointment and take them. It's as simple as that. Because quite often they're frightened. Because they're men, they're thinking, I should be all singing, all dancing. I have the answers to everything, and quite often they don't. And just being in the doctor's practice, not speaking on their behalf, but just being there to support them is often all that is needed. And that can save their lives and certainly give them a better chance of survival. So thank you very much, Danny, for sharing your journey. I could see it was quite emotional for you. It is an emotional journey because quite often you are then faced with what if, and you haven't talked about the sexual aspects.
Yeah, I didn't want to go there.
No. It is, you do want it. This is the arena where it should be shared, because having those symptoms will have an impact on the gentleman's ability to perform, and those are very sensitive issues in any relationship, whether or not you've got prostatism or prostate cancer or otherwise. So these are the things as a partner that you will have to navigate You'll have to consider what's the future going to be like if my partner cannot perform in the bedroom anymore. And these are the discussions you'll need to have, very sensitive ones. So thank you very much once again, and let's put our hands together for them.